everything we could. We've had so many of our legislators out here to help us save this health system and save these patients. I still in my heart don't believe it's over. I still in my heart believe somebody is going to help us. I don't believe that in this world where we are struggling so bad with humanity that nobody sees what we see and that how desperate these patients need care. They may say they're closing us, and they're trying to do it so rapidly. What's going on in the building trying to get patients out and get patients discharged, and it's unbelievable. We've had nothing from administration other than that we're closing and get the patients out as fast as we can. This has been our cry all along. When this for-profit company, Prospect Medical, came in here 9 years ago, they accomplished exactly what they came to do. They came to take every penny from our system, from us, from this community. They embezzled it all, they stole it all, and now they're going to go, and they leave us with all of this destruction behind us. I have said it 1,000 times. Please, somebody hear us. Our patients have nowhere to go. They can transfer them all today. They're very proud of the fact that they're finding beds for everyone and sending everyone home. Where do they go tomorrow when the crisis center's gone and the emergency room's gone? University of Penn is not close. Riddle is not close. Christiana Care is not close for any of us and for any of these patients. Where do they go? They die. Who's going to tell the mom whose child dies of an asthma attack that her child died because she couldn't get care close enough to be able to save her child? What do we tell our trauma victims' parents when they could have been saved because a ride 10 minutes down the road and summer's coming and our traumas rise? And who's going to tell these parents that their children died because we couldn't get them somewhere quick enough? And I have said this, and I have said this, and I have said this, and I can't say it anymore. It is real. It is real. And I hope you are all here when it happens to comfort those families and to comfort all of us who just can't bear the thought of what's coming. But nobody cares because it doesn't have anything to do with people. It only has to do with money. They don't care about the employees here. They have taken everything from us. In the end, they take our PTO, they take our pension, they have tried to take everything. They don't care. We don't hear anything from them except, oh, sorry, we tried everything, we're closing. When we know that's not true. We know that all of our local officials tried desperately to get a consortium in here to try to save us. And we were all excited because we thought it was happening. And at the last minute, Prospect once again pulled their final stunt and said no. And so that's what we've lived with for 9 years. And look, I'm so proud. We have almost 3,000 employees still here, and all the patients still keep coming. That's a testament to what we do here and to the county that we live in. This is going to devastate our entire community. I've said it, and I've said it, and I've said it, and I can't believe that we're going to live this. And I still have hope. I have a strong faith in God, and I really believe that someone's still going to come in and somebody's going to restore health care here in this building, in this community that we all love so much. I don't even know what else to say except that we have fought the fight, and I have never been more proud of the fight we have fought. And I love every single person who's here today who has stood and fought with us, because this was never about us. This has always been about the patients. And where in America have you ever seen people who put everything aside because they care that deeply about their patients? We buy them clothes, we buy them toiletries, we give them rides. Nobody knows what the staff here at Crozer has done all these years for these patients, because this monster company has not. They provide soap that doesn't smell. They provide toothpaste that has no taste. What we have done may seem simple, but to the people in this building that we have cared for, they know we love them, and we will love them forever, because this has been home for all of us. And so, I'm never going to give up hope. I'm going to continue to believe, and I'm going to have hope that all of us continue to pray for a miracle, because I don't believe this is over. I don't believe that these monsters can be this evil, that they come in and they shut these doors and they take away the only resource, sometimes the only family that these patients have. We know we fought the fight, and again, I'm so proud. Today, we know that this isn't over. They may close Crozer. We're all very well aware of what's the reality here. But this can never happen again in this city, in this state, in this country. For-profit cannot come in and take away all of the rights of the people in a poor community. And with that, I'm going to bring up Leanne Kruger, who truly has been our strongest advocate. Leanne has stood by us forever and ever. Carol Kazim is going to come with her, and Gina. I can't even begin to tell you. Everybody says, what are the politicians doing? Why couldn't they get it done? I truly can tell you from the bottom of my heart, they have stood with us every second, and they have fought as hard as they could fight. These monsters were bigger than all of us, but we're not going to stop fighting, and we're going to continue to pray for the miracle.
I'm Leanne Kruger, and I represent the 161st districts, including where we stand right now in Upland Borough. My colleagues Carol and Gina and I stand here to represent the rest of our delegation who's already at the Capitol, some of them literally in meetings right now, working on bills to ban private equity in healthcare and ban leaseback deals like what Prospect did here, so this never happens again. So we stand here to represent all of our colleagues in the House today. We'll be getting on the turnpike right after this. So at 2:30 Eastern, there's another hearing, because we know Prospect chose to file in Texas in a bankruptcy court that they thought would be most sympathetic to their cause. The judge has over and over again pushed for a solution here, and she has said that we need a hero. Well, today at 2:30, we need that judge in Texas to be the hero. There will be lawyers in court objecting to Prospect's closure motion because they want to close this hospital within days, not months like the regulations require. They are breaking the law, they are breaking Delaware County regulations, and we need that judge to stand up to them today and say, hell no, you need to follow the rules, you need to get back to the table, and you need to stop being so greedy. So today we call on the judge to be the hero for Delaware County. Now my colleague Gina Curry.
Thank you, Leanne. I want to be the person right now to let everybody know that, like Peggy said, we have to continue to hold hope, because there are people right now. I just talked to a constituent on the way here who said her mom just had surgery 2 days ago in there, and she doesn't know where she's going to have her follow-up. There are women who are about to give birth this week, and they don't know where they're going to have their babies. There are people who, like Peggy said, will be in a traumatic or a trauma situation and won't have anywhere to go. We, as the people who are being impacted regularly, I represent Upper Darby, Lansdowne, and East Lansdowne, and Millbourne, and my constituents also come out here to Crozer. We know that throughout the entire Delaware County, Crozer has been our healthcare system. And so now we have to stick together. We have to stick together, right? It's not the time to be pointing fingers at anybody here in the community, because we know Delco is a strong community. So we need to make sure that we're checking on our neighbors. Hey, what can we do to help you to get to this place? What can we do to help you to get to your care? We need to be doing that right now, because we know that Prospect let us down. Prospect actually shoved us into a space that we can't return from in our critical care. So now I'm asking the community to come out. We have our offices. Please call our offices. We have resources numbers that you can call, and we need to stick together as the community that we are here in Delco, because we know we are a strong community and this will not hold us down. And I'm going to introduce now Representative Carol Bazim, who a lot of you know because she lives right here in this community, and she has been a strong fighter for this very healthcare system, and we just want to hear a few words from her.
Good afternoon, everybody. I'm not going to sit here and lie and tell you that I am, happy that we're even standing here. I was asked to say a few words. I'm not even going to lie. I don't even know what much to say, but one thing that we have learned as a Commonwealth and as a community is no privatized entity has any place in healthcare. And that we definitely and should have learned our lesson from this. And to know that everyone is standing here thinking about what are we going to do, knowing that our offices are open for the residents, the communities, but don't even know what to say even for the patients that are even inside. But first and foremost, I want to thank every healthcare and employees that is out here for all of the dedicated years, time, and effort that you all have put into our community, our residents. It does not go unnoticed, and I don't want you all to feel as though that you failed, because you have not. The Lord had called each and every one of you guys to be in those positions for a reason, and he called y'all for the time for this. So I'm going to end off with what I know how to do best, because I don't really know what more to say. Come here, Gina. And Leanne, where am I? So we're going to do a prayer, because that's the only way I know right now how to fight. And I know we talk about what is left, but when there's nothing that we don't know how to do, we go to God about it. So for those that want to participate, for those that don't believe, it's okay. Some may not like it, but we got to lean on the Lord, whether you like it or not. So for those, please bow your heads as we do a prayer as a community. Heavenly Father, as we stand here today, we are here as your children. There are some that speak in their native language and their native tongue. Some call you Yahweh, some call you Jehovah, some call you Allah, and some call you other names. But we are here together as one. And we are here asking for your help, for your guidance. We are here on behalf of the patients that are in the hospitals right now. We are here for our family and our loved ones. We are here on behalf of our first responders and our healthcare workers. We are in a time of uncertainty. There's so much chaos right now going on in the world. And we don't know what is going on. We don't know what's ahead. But what we do know is that we put all of our trust in you. And we know that you will make a way. And we are asking for your guidance. We are asking that you grant us all with wisdom on what to do next. Give us the tools and the resources that we need to help our communities. Give every leader the strength to move forward so we can help the people that are in need. Stretch your hands upon every single neighboring healthcare system at this time, because they are going to need your strength, Lord. And we ask that you continue to be with us. Continue to show us the light. Continue to help us. And we know, I know, that you are going to seek judgment for what has been done. Because every knee shall bow and every tongue shall confess. So as we move forward, order our steps. We thank you for each and every one of our lives, that we are still here in the land of the living, which means we have another chance to serve your kingdom by finding more opportunities for the people. We thank you, Yahweh, for bringing us here together. And so shall it be, so shall it be, that we will rise, we will overcome, and that we will deliver testimonies. And we're going to shout Hosanna to the highest heaven. Once again, we thank you all, and all of God's children in every native language and tongue. All God's children say, Amen. Amen. Thank you all again for being here.
Thank you so much, because we know that's what we have left, and it's all we ever needed. Next, I'm going to introduce Bill McCall. He is the president of the Crozer Health Paramedics Association. And I know.
I'm also going to have Rob Worthington with me, who's the vice president of the union. Who's pissed? I'm pissed. I've been here 21 years. Good. 21 years ago, I started here. I cut my teeth in the city of Chester, learned from some of the best paramedics I've ever worked with, come in and brought patients into the ER with some of the best ER nurses that I've ever seen and ER doctors. Never had an issue with any kind of patient I brought in here, hurt, sick, wherever, because I knew they were going to get the proper treatment. I was on the street yesterday when I got the text that these people are going to try and close our health system. And I'm just sitting there and I'm thinking, three things went through my head. Time is muscle, time is brain, and golden hour. And what do they all mean? Time is muscle is a heart attack. They're taking away our STEMI center. Time is brain. They're taking away our stroke center. Golden hour refers to trauma patients. They are taking away our trauma center. From definitive care, everything that requires time and definitive care is being taken away from these people. People are going to die on the way to the hospital. There are mothers that are going to have to give birth that it may be a possibility now that they're going to be born in the back of an ambulance on the way to the hospital when that wouldn't have happened before. This place is my family. I love this place so much that I even brought my wife and my daughter with me. My daughter has a letter that she wants to read that she wrote.
Good afternoon, everybody. My name is Rachel McCullough, and I'm a EMT here at Crozer. This is Bill McCall, Chief Shop Steward of the Crozer Chester Paramedic Association, and he's also my stepfather. He is my dad. I'm sorry.
Okay.
I've been an EMT since 2019, but I've been working in EMS since I was 16 years old. Matter of fact, I was born here at Crozer in 2001. I was raised by two Crozer paramedics, my mother and my stepfather. I was trained by Crozer EMS. Matter of fact, my FTO is right here next to me. Crozer EMS is now my career. Crozer is my career. The career that supports my entire household. Everybody that lives inside my house is supported by Crozer. I have spent more of my life at Crozer than anywhere else. I was raised inside the walls of Station 100 up the hill, raised by paramedics and EMTs. I actually waited to come here because I wanted to make sure I was worthy to join their ranks because Crozer had the best healthcare providers that this county had to offer. Being a member of Crozer EMS means I am part of one of the best EMS departments in this county, if not this state. We are there for the best and worst days of people's lives in their homes and in their communities. We have a much different perspective than many others who work for Crozer. We see the real, raw, unpolished sides of our communities, and we do whatever it takes to improve them and improve the lives of many. The loss of Crozer EMS would go beyond hospital walls. It would affect the entire county, even areas where there aren't Crozer buildings. It would break relationships with towns, cities, boroughs. It would break relationships with schools, fire departments, police departments, businesses, and the communities that hold them. It would throw our entire county and neighboring areas into a major crisis. It would risk lives by adding to the already major EMS shortage that we face. To close would be a betrayal, not only to the employees and their families, but to the entire county. It would be the ultimate betrayal to this region, to this area, to the people who stand behind me, to me and my family, the place where I was raised. Thank you.
Hello, my name is Rob Worthington. I'm the Vice President of the local paramedic union, representing over 150 men and women who proudly serve each and every resident in over a dozen municipalities. For over 50 years, we have been here for the public in their times of need. No matter the situation, no matter the weather, no matter the time of day, no matter the circumstances. Working alongside with the best police departments, fire departments, nurses, doctors, providers of everything you'd never think of in your normal daily lives. Delaware County is about to be devastated if this closes. This isn't just a building of one, like it was repeated. We go from here to Upper Darby. The support we have received from our fellow emergency services workers during a stressful time has been unbelievable. With that said, I want everybody to take 1 second and just take a look in the back. You might not see them. Some are in uniform, some are not. They came here on time off. Police officers, paramedics, firefighters, all right? They've been here with the 150 men and women from our paramedic department. I want to thank Delaware County FOP Lodge 27 has been there day and night for a phone call for advice. Upper Darby firefighters, professional firefighters, local 2493. Chester professional firefighters, local 1400. I want to take I guess you call it personal thank you. Every time we have one of these events or a small get-together or a simple phone call, there's two people that have always stuck out in your mind. Take politics aside, whatever you vote doesn't matter. We want to thank State Rep Leanne Kruger. Leanne has been there for myself for many, many years for other different reasons through the years. Always been there, always been receptive, always been responsive. Not here today, but she is in a meeting for today. Delaware County Council, Dr. Monica Taylor. So I want to read a little something that's been collected from your paramedic department. The paramedic department from here to Upper Darby. We do over 45,000 calls a year. The Crozer community has been committed to providing pre-hospital care to 184 square miles in Delaware County. Each year, those care providers respond to increasing call volumes, with patients being transported to Crozer care facilities. Crozer has faced the closure of 2 other facilities of 4. And we've felt those constraints both internally and externally for care. Now, as we face closure, we fear the worst for our community. EMS response times will drastically increase. They're not good now, we are short-staffed. We have broken equipment, aging equipment. Ambulances with over 300,000 miles that these men and women still get in every day and push to no end to get to everybody in the public. These delays on our calls death. As much as you don't want to hear it, it's reality. Like Bill said, the golden hour, we got to get you to care quicker. As we stand here before you, speaking, we serve as a warning to all those who reside in our 184 square miles. Be prepared. We have been trained as providers to be prepared for the worst. We are left lifeless with no life support. We continue to respond as needed, As our past EMS chief, Bob Reeder, stressed, we don't say no when someone asks for help. We find a way. As a member of pre-hospital community, we stand before you to say we are committed to the end. We're not going anywhere. We're going to stay here. We do this job for you. It's not for the money. It's not for prospect. It's for the care that we provide to people. We leave our homes. We miss holidays, birthdays, family events numerous times a year. It causes dramatic problems at home because we want to provide to the community. We're not waving that white flag. Not only are we your providers, we are contributing members of this 184 square miles. We refuse to wave goodbye, but how can we serve you better? Those standing here understand the call, and we will not let it slip away.
Thank you so much. Next, I'm going to introduce Judy Ramos. She's the president of the Crozer Society of Pharmacists here at Crozer.
I've had the privilege of working at Crozer for the last 38 years. Anyone who knows me knows that I am much more comfortable at the back of the crowd offering my silent support. But I'm up here today because I am committed to Crozer and to the community that it serves. I remember when Prospect first came here. We were busy, our beds were full. If only the profits generated back then had been reinvested into our hospitals, fixing our infrastructure, buying new equipment, making our hospitals thrive, we wouldn't be standing here today at the brink of closure. But those profits were directed into the pockets of a select few at the detriment of a whole community. For-profit entities do not belong in healthcare. Their goals are the complete opposite of what motivates healthcare workers. We are here and have been here for years because we understand the critical nature of the care we provide. Quality health care is something we all need when we're sick and injured. It should not depend on where you live or how much you earn. You have heard us say that if we close, people will die. Some of you may think we're being dramatic or it's a hook to get you to read the story, but we all know that it's true. We have seen countless times the lives saved at this hospital. The car crashes on 95, the gunshot victims, the burn patients, the strokes, the heart attacks. These people survive because there's quality care available here, minutes away from where they are. Having to drive 20 to 30 minutes away can be the difference between life and death. And for some people, they won't arrive in time. How sad that Prospect wants to shut down that lifeline. And not only shut it down, but to do so in such a fast and reckless manner. They don't care about these patients. They don't care about the laws that were put in place to protect these patients. I stand here with you all today to remind everybody about how much this community needs us to stay open. If there is any way to stop this closure, we must find it. And if we have to close, please do it slowly and responsibly so that other healthcare providers have time to build a safety net for our patients. Whether our doors remain open or not, we will always care about the people in this community, and we will always fight to keep for-profit entities and their corporate greed out of the healthcare system. Thank you.
Next, I have Tom Polizzi. He's the Vice President of the Crozer Medical Professionals.
Thanks, Peggy. I'm going to pull Yahida Turner, the president of the Crozer Pros, up here as well. So, We're all here once again to hold this system together as best we can, despite everything Prospect is throwing at us. Many of my friends and colleagues here are sad. I get it. I'm not sad. I'm angry. We should all be angry. This isn't a tragedy. This is a crime. This is failure by design. This is what they want. We have watched day in and day out as millionaires in California have chosen to squeeze every cent out of this system, even though they know it costs lives every day. They chose it anyway. They continue to choose it every day. Make no mistake, as my colleagues have said, many, many more people will die if this is allowed to close. If Prospect is allowed to collapse this system like they want. It's not just the car crashes, it's not just the gunshots, it's the overdoses. It's the suicidal patients who can't get to their outpatient providers. It's their families who are in danger. It's the grandmothers and grandfathers who can't make it to Philadelphia when they're in respiratory failure or heart failure or renal failure. And make no mistake, it is not just the folks in this zip code that will be affected. It affects everyone. It affects everyone in this region. We have patients in Delaware, in New Jersey, and across this area. We should be angry. If this system is allowed to be collapsed, it is my hope that the Attorney General pursues criminal charges against those responsible. I am angry, but I too have hope. I have hope because through COVID, through a cyber attack that left us without computers, through how many fires, everyone here kept showing up. And we keep showing up. Now, Prospect is much more dangerous than any fire that can take place in this building. But we are still here. And they will have to pull each and every one of us out of this building if they want it shut down. We have 2 hours. We know Prospect will not choose to do the right thing. We're past asking. Now it is our hope, we are begging, pleading, that the judge does. Thank you.
Next, I have Melanie McHenry, one of our lead assistants here at Crozer.
I just want to take a second and thank everybody that's here. I work in the ambulatory setting for GYN oncology.
Sorry, take your time. Take your time.
Our patients are going to die, and that's a fact. Them closing us is going to disrupt chemotherapy. We have patients who are actively getting treatment that are being abruptly told that they have to find care elsewhere in 10 days. I'm going to put a scenario out there. Imagine being diagnosed with cancer. You're stage 3. You're introduced to your oncologist. You get your surgery set and scheduled, and you're so happy that you're finally going to get a treatment plan, and get told 2 days before your pre-admission testing that we can't treat you, and you have to find someplace else to go. Is that fair? No. Does anybody think that's fair? We have patients have called us non-stop, distraught, begging and asking us where we're going, and we don't have an answer. We have patients that it's not just about the chemo treatment, it's about prior authorizations, going to different locations and having to have your chemo reauthorized. That's going to be a lull in care and death will happen. All I can hope and pray is that some Hail Mary comes through and it saves our jobs and our patients, because we're not just workers. Our insurance capitates us here. So we're patients too. We're losing our providers as well. It's not fair.
I also work in the same office as Melanie. That scenario that she gave you, that wasn't a scenario. That was an actual phone call that I made this morning to a patient. I had to cancel their surgery because we can't care for them. What Prospect is doing to this hospital, to this community, the patients and employees is criminal and it's hurtful. And like my coworker said, I pray that some form of Hail Mary comes in, because some of our cancer patients cannot get to Philadelphia and other healthcare systems. They're only able to get to us. And what are they going to do now? I pray for a Hail Mary, because this is a mess.
Next, I have our brother, Matt Palenka, one of our colleagues over at Taylor Hospital.
I'd like to thank everyone for showing up. Unfortunately, Prospect has shown its hand once again and has decided to close this sooner versus later for what boils down to corporate greed. Unfortunately, as has been stated before, people are going to die from this. The county is going to have more issues than is possible, and there will be people that will have nowhere to go otherwise. And it was just stated, those of us who work here or work at Taylor Hospital, which I am a part of, our insurance is through here, we have no place to go. So we are hoping that the judge in a couple hours will see us have time. We need to have time to get through all this. Otherwise, there's no time for this county, for the patients, and the people that work at both Taylor and Crozer. Thank you.
Thanks, Matt. And you're right, there's a hero out there. Whoever you are, we're waiting. Next, I want to introduce Chester City Councilwoman Portia West and also Danielle Blackwell.
Thank you. And I'm going to ask Councilwoman Tamika Gibson to come up. Good afternoon, everyone. Good afternoon. I'm here standing before you on behalf of Chester City Council. I'm the deputy mayor in Chester, and our mayor, unfortunately, had a prior commitment. I'm here with Councilwoman Tamika Gibson, and also representing Councilman Fred Green and Councilman Shaquan Davis. And we want you to know that our hearts are broken. Hearts are broken. I wake up every morning with a burden in my heart. I just lost my brother to cancer. I lost my mother to cancer. And I know how important it is to be able to get treatment when you need it. When it's unavailable, that's a horrendous thing. I want you to know that we, the members of council here in Chester, we're making a commitment to our county officials, our state representative, Carol Kazim, and I'm asking for a hand clap for her, because without her, I don't know where we would be in the 159th district. Thank you, State Rep. There's so many people here who are concerned, and I know prayers are going up, but Pastor Dickey, I know a God. I have a God who sits high and he looks low, and he's going to bring us out of this. He really will bring us out. Hope is what we have to have. Hope in God. Hope in Jesus. He's my Lord and Savior. Hope. Hope. There's so many people here that I'm thinking about. The healthcare professionals, the EMS, EMT professionals, the doctors, all of the staff at Crozer Chester. And it's not just Crozer Chester, but it's also Taylor Hospital. I worked there as a nurse's aide when I was in high school. I mean, these institutions have so many memories. And then I think about our seniors who don't have the ability to get proper transportation to doctor's appointments, let alone coming to the hospital. You know, it's just not available to them. So yes, we have to work together and see what we can do as a community, collectively, to make sure that we get what is rightfully ours. We deserve adequate, more than adequate, health care. We deserve the best in health care. We deserve it. We deserve it. And the people in Delaware County and Chester, they're going to be deprived and significantly impacted by what's going on here. And then I think about the employees, a lot of you I know, and how, you know, your jobs are going to be impacted. And that means that's a liability for your household. Yes. So I'm praying every day that our people will be saved from this dilemma. State Rep, you touched my heart last night. You really did. And I thank you. I want to publicly thank you. I can't thank you enough for what you do. But I want to leave a quote from Dr. Martin Luther King. And he said in one of his quotes, "All labor that uplifts humanity has dignity and importance and should be undertaken with painstaking excellence. And remember, whatever affects one of you directly impacts all of us." God bless you all.
Good afternoon, everyone. I'm Councilwoman Tamika Gibson-Williams. And when I heard of the news of the closing, my heart was devastated. I keep hearing a lot of what ifs. And all I can do is remember the time, 2015, when I had to be rushed to the hospital. We were only 5 minutes away, and the 5 minutes away led me here to Crozer. And the nurses and the doctors and the EMTs, the paramedics, they got me here in time. But what if the person can't get here in time? They will lose their life. I made it because I got here in 5 minutes from Trainer to Chester, and it saved my life. What Prospect Medical has done to our community will greatly affect many of us. But I want to thank not just the doctors, the nurses, the LPNs, the kitchen staff, the whole entire Crozer system. So I applaud you today for coming out and standing up for one another and standing together, letting Prospect know that we will not take any of this. And I know that we serve a God of the 11th hour. So I'm going to continue praying that God makes a breakthrough and a miracle happens on today. That's all I have to say, and I thank you all. Keep on praying and trusting in God, and I believe this thing will turn around.
Hello, everyone. I am Councilwoman Danielle Blackwell, and I just want to say I thank you for coming out. I thank you for supporting our healthcare system. As you know, we need the hospital. We need this hospital. Delco is very strong, and we need to be stronger with our hospital. I don't want any of you to underestimate your power in what you can do in coming out here. I want you to continue to stand strong for this healthcare system and never give up. We're going to let that judge know down in Texas. We're going to let that judge know down in Texas that we are together. We're together, right? We're together, and we stand strong. We will not give up on our healthcare system. We will never give up on our healthcare system, and we will make sure that they come to us and they work with us and keep us alive, because we need to stay alive. Time matters. Thank you so much. Appreciate it.
And we do need to pray hard for all of our elected officials who are going to be there with the judge today, and that God intercedes through them and they are able to get our message across that says we need to save this health system and save lives. Next, I have our good friend, Senator Tim Carney. Senator, we are eternally grateful. You have been here with us from the very beginning, and we will never forget the work you've done for us.
Thank you, Peggy. So here we are again. It's hard, I agree with Peggy, it's hard to believe this is actually happening. You know, when so many good, smart people work so hard to try to get to an outcome, it's amazing that we can't get there, or we don't seem to be able to get there at this point. I agree with Leanne, we are at a point right now where we want the judge in Texas to understand that this is more than just a spreadsheet. This isn't about dollars and cents on a piece of paper. This is about people's lives. It's about the humanity of the folks in Delaware County. She has often said the right thing during these hearings going forward. I'm hoping that she does it again today. And I hope that our advocates there push for it. Just wanted to say that, 26 years ago, I showed up here at the Crozer emergency room with what turned out to be a burst appendix. I had bursted 2 days before, and being a stubborn Irishman, I never quite made it down here. But so I can testify the fact that this is 10 minutes from my house. My life was saved here because it was only 10 minutes away. And, I was in the hospital for, I think, 8 days afterwards, which was, but it was just a formative experience for me, something that I always remember, and something that keeps this fight personal for me. I want to end up basically with a plea. We can't change what Prospect has done, but we can make it illegal. And there are bills that we've been working on in the legislature, and my friends in the House have passed it. They passed the bill last year. It went nowhere in the Senate. And this is nonsensical to me because, Crozer is one of the hospitals that are in these kind of situations, but the majority of them are in rural communities. They're these small hospitals that are out in the sticks, if you will, whatever. But those are the people that are represented by the people who aren't stepping forward to support this bill in the Senate. So my plea with them is to understand really what we're dealing with and to pass this legislation so we can at least send the message that private equity is not welcome in healthcare. So I want to thank everybody for coming out today. I think, the fact that the healthcare professionals are still here, still working, still being here, says an awful lot, because they could have left. They could have seen the writing on the wall and done what they did. I ran into Max Cooper last night in a restaurant in Media. He was with, I think, 7 other doctors. They weren't, hey Max, they weren't talking about what was going to happen to them. They were talking about the residents. They were talking about the people who are still in the training programs who really need to kind of step forward and what they were going to do for them. So to me, that's indicative of the kind of healthcare professionals and why I'll always be here for you. I'll always stay with you.
We should have coordinated that better. He could have been the introduction, because next I have Dr. Max Cooper.
Hey everybody, I'm Dr. Max Cooper. I'm an ER doctor here at Crozer. When I came here 7 years ago, I wanted nothing more than to end my career here. But not this way. Not this way. This isn't how anyone wanted it to end. We save lives here. We save lives here. And when I was here last time, I spoke about how seconds matter in our fight to save lives. Just this morning, in the emergency department behind me, my partners, my students, our colleagues in nursing, received a patient who was having a major heart attack, and they provided fantastic care, and they rushed him up to the cardiac cath lab. And as he arrived, his heart stopped. But because he was in our cath lab, and because he had a cardiologist next to him, they opened his blood vessel, and they restarted his heart. And he's alive right now in our ICU because this hospital is here, and this hospital is open. If he had to drive 15 minutes down the road to Riddle, or 30 minutes down the road to Penn, or across state lines to Christiana, he would have died in the ambulance, and they would not have been able to resuscitate him when he got to the ER. In our fight to save lives, seconds matter. And I agree with what the gentleman earlier said. This isn't an accident. This isn't an oops. This is planned. This is on purpose. And this is criminal. And they need to be held to account. In the eyes of the healthcare workers here, in the eyes of Delaware County, are set in our elected leaders, and they're set in the AG's office. And we're hoping that you guys can claw back millions of dollars from Prospect's cold dead body. And when you do, I hope that you can set it aside and think to this community's future and how we can rebuild our healthcare system. Thank you.
Next, I have Vice Delaware County Council Chair Richard Womack.
I am Richard Womack, Vice Chair of Delaware County Council. I'm on behalf of County Council. This is a sad moment, an unfortunate moment. One moment that we should not be standing here. But one thing I have learned, and I have heard, put not your trust in man or your confidence, because they will fail you. Well, Prospect, you have failed us. You have failed the workers. You have failed our patients. You have failed our community. You have been nothing but a failure. You had committed criminal act here, and you need to pay for what you have done. I want to say to the workers, to the healthcare workers, be proud, because you stood up. Even when Prospect wasn't in our favor, you still stood to the test. You cared about the patients. You cared about the communities, and you still care. That's why you're here today. And I commend you and I thank you for all you have done and will continue to do. This battle is not over. It's not over. We got to continue to stand. We got to hope against hope and keep our faith, because I believe that there is going to be a reward in the end. We're at the darkest hour right now, but I know the sun is going to shine. So the sun's going to shine in our community. The sun's going to shine on our patients. The sun will shine on our workers as well. Continue to hang in there. But we will prevail. We will prevail. Because why? We are fighters. And we don't give up, and we won't give up. Thank you.
Next, I have our Mayor of Upland. Phil, thank you so much for coming. So much.
Thank you so much. My name is Bill Denon, Mayor of Upland. I want to thank every one of you that go here every day and fight for every one of us. I mean, I see it firsthand. I know the numbers from what I see of our calls from our police officers and our fire. Can't thank you enough from bottom of my heart, from my council's bottom of my heart. They work very, very hard. The numbers are unbelievable for our it's a square mile, Upland. It's going to devastate every business, every one of these workers. And one thing that I really get pissed off too is seeing the faces of all the angry people, as well as our flag upside down, meaning distress. Okay, so we need to just keep coming together and fight, and let Prospect know, and let that judge know, really, this is uncalled for. No way can we let this happen.
I mean, it just cannot happen. So we have to stand together. And I really appreciate everything that everyone does. And I'm praying for you, and I'm going to stand here all the time for you. All the time. Thank you.
And we'll close today with Maureen May, the president of the Pennsylvania Association of Staff, Nurses, and Allied Professionals, truly our biggest supporter.
So today is Earth Day, and what I want to do is unearth the for-profit private equity system. That's what Earth Day means to me today. This is a disaster, but you know what? Healthcare workers and our providers here in this institution, we know how to take care of disasters. I've been a nurse for 42 years in critical care at Temple University Hospital, and I can't even imagine the devastation that will happen to this community if this system closes. What time is it? I think this is the golden hour. The golden hour for the judge to step up and show us that she is for humanity. And I just want to read our mission statement. The purpose of the Pennsylvania Association of Staff, Nurses, and Allied Professionals shall be to protect and advance the interests of its members and promote safe, quality care, and campaign for laws which will improve patient safety and will provide better working conditions. PASNAP is an aggressive focus group of true humanitarians who are committed to the healing mission of patient care and to the oath of do no harm. Yet despite our optimism and at every attempt that PASNAP, our legislators, and our community has made to prevent this sentinel event, which is what it will be, we know that Crozer Health system is collapsing under the financial pressures imposed upon it because of the for-profit system that places the values of patients' lives and healthcare workers' employment last. This cataclysmic event is and will continue to devastate Delco unless the judge steps up. It is important to know that the closure of Crozer Health system is not just a mere disruption of employment for the 2,600 workers that work here, but it is a huge assault on every worker who enters into this noble profession of caring for patients, believing that the system would protect them and the patients that they care for. This is a tragic lesson. This is one that's being played throughout the Commonwealth of Pennsylvania and throughout our country. We have laws that do not allow this to be criminal activity, and that's why Prospect is getting away with it. We need to make sure that this egregious dismantling of Crozer system never happens again, and that Prospect Holdings somehow are accountable for the death and destruction that will happen in this community. Where is their liability? Shame on Prospect's private equity owners, Leonard Green and Partners, for prioritizing profits over the care of our patients, of our community. Remember, our union's mission statement states that we will campaign for laws which will improve patient safety, and we are committed to changing our weak laws that allow this dismantling of healthcare and vulnerable communities. Missions matter. Our mission at PASNAP matters. That's why we're here today. That's why these healthcare workers are here today, because PASNAP cares. Missions matter. And when missions matter, patients matter. 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 Thank you very much. I appreciate everybody that is here from the community, our legislators, our healthcare workers. Stay strong. We are here for the fight. Thank you.
So I'm going to end with what I began with. How did we get here? I think Senator Kane is somewhere. Senator, thank you for everything you've done. He's always been another amazing supporter of ours. But here's what we know, and it's what we've said all along. We will not stop fighting. We will not let them do this to this community. And so we all stand here today. Everybody's still showing up for work. Patients still wanting to come, although Prospect's trying to stop that. We need the judge to make it stop. She needs to slow it down so that our hero can come, because I believe our hero is still out there. These patients matter. We all matter. And you know what? I believe with everything in me that there's a God above, and he's looking down upon all of us, and we are going to get this done, and we are going to stay open, because these patients matter. Thank you all, and as I said it before, I love you all. We've been on a long journey together. It doesn't end here. We will be here until the last patient leaves and they lock us out. But we will not stop, because we all care so deeply about the patients and this community. Thank you all for coming.